Good morning. Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine, Consultant Neurologist. So today I'll be discussing on the vascular tissue for the amateur students. So what is vascular tissue? Vascular tissue is the network of blood vessels that transport blood throughout the body. So here you can see the network of vessels. So that point is clear to you. No organ can survive without blood vessels. So vascular tissue is essential for the maintenance of life. So here you can see this is the artery which divides into branches and finally loses the muscle tissue and it becomes capillaries. So capillaries are vessels, network of vessels where there is no muscle tissue. It's a single cell thickness. These capillaries has got an arterial end and a venous end. Because the capillaries forms the same way, capillaries join together to form news, then they form veins, and finally has two large veins. From the upper part of the body by the superior vena cava, and the lower part by the inferior vena cava, it reaches the heart. That is, it reaches the right atrium, about which we have discussed earlier. So this circulation is called the systemic circulation. The same way from the right ventricle, blood enters the pulmonary artery and reaches the lungs and it comes back to left atrium. That is the pulmonary circulation. So let us look into what are the components of vascular tissue. It consists of arteries, which divides into arterioles, capillaries, venules, veins. So here you can see the arteries. It divides into arterioles and finally they form network called capillaries. Capillaries join together to form venules, veins, and finally reach the circulation. Some amount of fluid is translating from the capillaries and remaining in the tissue without entering the veins. That part is drained through the what is called the lymphatics. So I will discuss the lymphatic system in a separate session. So this is the lymphatic. Whatever fluid is remaining in the tissue is retained back via the lymphatic system. Now we think about the arteries. The arteries carry blood away from the heart. Don't get confused as pure and impure blood. Arteries, any vessel that takes blood from the heart, away from the heart, is the artery. For example, the pulmonary artery from the right ventricle. So you can see this is the heart. From the right ventricle via the pulmonary artery, the blood is entering the lungs. So even though the blood is a impure blood, it is again an artery. So remember, pulmonary artery is the artery that carry the impure blood for the deoxygenated blood. So that is an exception for the other arteries. So arteries have got thick walls, high pressure, and usually oxygenated. The exception I have told you. So if you take the artery, it has got three layers. The innermost layer is called tunica intima. That is the inner part is called tunica intima. The middle part is called tunica media. So the tunica intima is the innermost part, middle part is tunica media, and the outer part is called tunica adventitia. So these are three layers. Remember the arteries are thick walled, it has got three layers. So veins carry blood towards the heart. So they are thin walled, low pressure. Remember their valves are present inside. So there is one peculiar. So here you can see that on your dorsal hand, if you see, there will be small bluish lines are there. They are the veins. Veins have got no valves. They are thin walled. Pressure is very low. So capillaries are very essential for the tissue perfusion. They are microscopic vessels. You can see the arteries divide arterioles and finally they form a network which is microscopic. And it is one cell thick wall. I already mentioned the thickness of this capillaries is only one cell. So it is a very thin vessel. So here these are the capillaries. As mentioned, capillaries as well. This is the arterial end of the capillary, and this is the venous end of the capillary. Capillaries join together, form venules, and then finally they form veins, about which here is very. So in the capillary, the fluid is the nutrients are leaking out, going out into the tissues. Here are the cells. The tissues, as we have already discussed, tissues are formed of cells, and the capillaries are in the tissues and supplying nutrients by leaking through the capillaries to the space between the cells. The space between the cells are called interstitial space. Interstitial space. So the fluid is going out from the capillaries into the interstitial space for vascular. Then a few words about the difference between arteries and veins. Arteries, as mentioned, thick walled, no valves. Veins are thin walled, valves are present. So here you can see it's a thick walled, and veins are thin walled. Then capillaries. Capillaries are three main types. One is continuous type. That is, in the brain and muscle, there is no, you can see the wall is formed of cells without any space in between. So these are the cells you can see. So it is called continuous. In kidney, it is fenestrated. There are so many holes in between, or a space for leaking of the fluid is there. That is called fenestrated. It is kidney. The kidney structure is called a glomeruli. So the word will be studied later. Sinusoidal type is in liver. So there are three types of capillaries: continuous type, fenestrated type, and the sinusoidal. So remember, kidney, it is fenestrated. 8 days we will study later. Just remember the fenestrated. And in the liver, it is called, it is sinusoidal. In the liver, why you get is a liver, you get a sinusoidal. So these are the liver cells. So here you can see the liver cells are there. And in between, you can see the venous lakes. So something like a lake, that is the venous sinusoids. So the arteries are important for maintenance of blood pressure. The blood circulation is essential for tissue perfusion, healing, immunity, temperature control, etc. So poor capillary circulation causes delayed wound healing. That is why in diabetic patients, diabetics, the wounds are not healing properly. It is because of the poor capillary. So capillary perfusion is essential for tissue nutrition. So blood vessels are important from the MHA perspective for ICU monitoring, IV access planning, management of trauma, etc. So common disorders, one major important is atherosclerosis. You may have heard of the heart disease, coronary artery disease, coronary artery disease. So what is it? So in the coronary arteries, inside of the vessel, there is deposition of cholesterol, and the vessel wall gets thickened, and the lumen becomes narrowed. And this disease is called atherosclerosis. When it completely blocks, it forms what is called a heart attack or myocardial infarction. In the brain, it produces what is called a stroke. Further, so atherosclerosis is a disease where the cholesterol deposits in the vessel wall, is thickened, and the lumen becomes narrow. Varicose veins are the engorged veins that especially you see in the legs. So in next session, you will study about the shock. Shock is a situation where the tissue perfusion is affected and the blood pressure is low. Then summary, vascular tissues are vital for life, and we are discussed about the importance of the hospital management. Stay tuned for further videos. Thank you.